So we get asked about early treatment all the time. What is early treatment?
Yeah, I think one of the most common questions that we get from dentists and dental teams is like, when should we send patients over if they still have baby teeth? You know, what are some indications where early orthodontic treatment might be indicated? You know, when the child might be 7 or 8 or 9 and still has baby teeth. And there's a number of key indicators that we look for in young kids that might need some early orthodontic treatment. Like if someone came in and they've got like an underbite.
Yeah, so an underbite or a crossbite is really bad for the development of the teeth, and so that's one of those things that we want to fix early, right? Because it's only going to get worse. The most common one would be crowding, wouldn't you say?
It looks like those front permanent teeth have started to come in, and you can tell that there's not going to be enough room. A lot of times we can put in expanders to, you know, gently widen the arches and create more room for the rest of the permanent teeth to be able to be.
And it's got two other kind of side effects as well. If you think about a generation ago, we as orthodontists used to pull teeth all the time, and now the number of patients where we have to pull teeth is like drastically reduced. And the other thing is about airway too, right? I mean, expanding the upper jaw has a real beneficial effect on the nasal airway. We have a lot of patients that will snore, and now they don't snore anymore because their nasal airway is improved, and so it makes a big difference there as well.
Yeah. What about if like they have like an overbite? Like what if the upper front teeth are really protruded out?
Yeah, remember that one kid that came in that had the teeth that were really flared, and for whatever reason, the mom couldn't start treatment at that point in time, and then unfortunately she came in a few months later, and half of one tooth was gone, and that was really sad because when you have protruded teeth like that, and it's a kid, right? I mean, kids are going to be running around, and sometimes they fall, and sometimes they fall on their face, and the teeth stick out.
Well, I think the research shows once that distance hits about 5 millimeters, that the upper front teeth are in front of the lowers, then, you know, anything above that, we're really at risk of trauma.
Yeah. What about habits? Like we have kids that have like finger sucking habits, or they have a tongue thrust. We see those a lot too, don't we?
Having your thumb in your mouth, or protruding your tongue out can force the teeth apart from each other.
Right.
What would you do to fix that?
So oftentimes they just need a little reminder appliance there, just remind the kid not to put their finger in, and that works really well. And then the teeth automatically come together. Sometimes we may have to pull the teeth together, but many times just removing the obstruction works great.